Hi, I'm Dr. Jarek Conrad. Welcome to Healthy and Black, where I share information about the state of health for Black America across 7 categories, from emotional health to physical health. I became plant-based over 15 years ago after losing so many of my family members to chronic health issues. Now I want to help you take control of your health. Welcome to this episode of Healthy and Black. I am glad to have you here. Look, I'm in a process of launching a program. It's a mind body detox program, 12-week program. If you do what I say, I guarantee that I can help you reduce your blood sugar, your cardiovascular risk. It's a whole host of issues. But in preparation for this, I've been talking to a lot of my contacts. And one of the questions that I have is, what are your challenges? Like, what are you struggling with the most? And it's amazing to me that so many people say they still struggle with knowing what to do, just understanding what is healthy, what's not healthy, what to believe, what not to believe, so much conflicting information. And it's almost bizarre to me because I'm familiar with the studies and I understand the data around that. But I got to remember, I live in this world. I'm always thinking about this stuff. I've been doing this now for almost 20 years. So I thought I'd dedicate this episode to just going through some basics. Some basics. What do we know about chronic health issues and diet? Where does a plant-based diet fit into all this? Where do other diets fit into all this? Because knowing is one thing, right? Knowing and then now trying to figure out what to do, that's a whole nother issue. But I can't get to that issue if I can't get people to understand fact from fiction. So that's what this episode is all about. Again, delighted to have you here. So what do I do to help people understand this? Well, what are they saying about diets now? So I go and I look up top diets in the US, and there's a report that came up from US News and World Reports. And I'm looking at the first page of the diets. The Mediterranean diet is number 1 out of 5 points. It got a 4.8. And the Mediterranean diet has some great benefits compared to the standard American diet. They put it at 4.8. First page, I didn't even see the vegan diet. I had to go and look up disease-specific diets, and then I found a vegan diet, and they marked it at 3.3 out of 5 compared to a 4.8. So, wow, well, let me look into this. What is it that they're saying about the Mediterranean diet compared to the vegan diet that would boost it so much higher? And so, what they say specifically around health benefits of the Mediterranean diet: reduces risk of heart disease and stroke, which is very good; may prevent cognitive decline and dementia; might prevent type 2 diabetes; likely reduces the symptoms and progression of inflammatory and autoimmune conditions such as rheumatoid arthritis. So likely does, and it may help ease depression. So that's positive. That's positive. I can see why it gets such high scores. So I looked at the health benefits of the vegan diet. Again, this is the same report. Now I look at the thing that they rated as 3.3. What are its health benefits? Eating a vegan diet has been linked to a variety of health benefits. Its emphasis on whole foods, fruits, vegetables has been proven to be effective in terms of decrease inflammation. So it doesn't say it may decrease inflammation. It has. A vegan diet has been shown in multiple studies to decrease levels of C-reactive protein, blah, 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 blah. And it cites the specific studies that show a decrease in pain and inflammation associated with like rheumatoid arthritis, for instance. So not may, here's the study that shows this is what it does. Okay, next bullet point. When the Heart Association compares the vegan diet to its recommended diet, the vegan diet outperforms the American Heart Association diet in terms of reducing risk of heart disease. So it's interesting. Well, let's keep going. Additionally, there was a study of almost 12,000 people over the course of almost 40 years. that showed a significantly lower risk of cardiovascular disease-related mortality and all-cause mortality among participants who followed a healthy plant-based diet compared to those who ate any animal product. So not just heart disease, but all-cause mortality, like anything that'll kill you, the vegan diet reduces the risk of that stuff compared to not some or a little bit, it's like any animal products. And specifically, they list lessen risk of diabetes. They put a study in there of over 200,000 people that lower the risk of type 2 diabetes, improving brain health. They list a specific study. They don't say may with, Alzheimer's and all this stuff. They say in a study in 2022 of over 3,000 older adults, this diet resulted in better cognitive function and performance on memory tests. So it's just, this doesn't make sense to me. When you look at the Mediterranean diet, again, it has lots of health benefits, but there's not a lot of specificity, not a whole lot of studies, but it's their 4.8. You go down to the vegan diet, they list a whole lot of studies. They prove it, and they give it a 3.3. So what do we attribute this gap? Well, if you look in the notes under the benefits section of the Mediterranean diet, it says, because the Mediterranean diet is non-restrictive, many people find it easy to follow, sustainable for the long term, and adaptable to any cuisine or lifestyle. So in other words, it's easier to do, therefore we rate it a whole lot higher. It's easier to do, so we rate it a whole lot higher. Not, this one is the best. Now, let me let you choose whether or not you can do it or how close you get to it. It's rated based on the fact that we don't think you're going to do it. We don't trust you enough to make these responsible decisions. We know you can't do it. We think you are weak. We don't think that you can follow the diet that we're showing you has all these wonderful health benefits. Now, I don't know about y'all, but that's insulting to me. Now, let me read the risks. Maybe there's some risks associated with this thing. Let's see. In the Mediterranean diet risk, the lack of nutritional guidance regarding specific amounts of foods and portion sizes can lead some people to consume excess calories if they're not careful. And so you might eat too much. You may end up gaining weight and all that kind of stuff. But they don't list the risk that in the other part of their report, when they said the vegan diet is better than consuming any animal products, if the Mediterranean diet does allow you to consume animal products, then that should be included in the risk, in my opinion, if that's in their own report. But anyway, that's the risk there. So let's look at the risk of a vegan diet. What do they say? It may be difficult initially to eliminate all animal products in your diet. Again, that's why they ding it. You get all these benefits that we just listed, but the big risk is you might have to supplement vitamin B12. Now, how does this diet end up at 3.3? What was it? 3.3 compared to 4.8. So this is really about mindset, right? Mindset and what it is we think that people might be able to do. Let me go into these chronic health issues a little more deeply, because the U.S. News and World Report's report alluded to some things, but let me just set the stage. When you step back, you think about the fact that, about 75% of global deaths are due to chronic health conditions. And these are the quote unquote avoidable chronic health conditions. There are 129 million people in the US right now that are living with at least one of these chronic health issues. When you look at our healthcare expenditure, 90% of it is on these chronic health issues and mental health conditions. So this is costing us. It's costing people's lives. It's costing their quality of life, and it's costing us a whole lot of money. And this stuff is largely avoidable. And we'll get into that. It's not me saying that. It is all the authorities that you might trust saying that. And so we know the average American is having too much salt, too much sugar, fat, processed foods, and that is contributing to the burden of obesity and chronic health issues that we're experiencing. Our meat consumption is going up dramatically. The last study I saw suggested that we eat more than 200 pounds of red meat and poultry each year, 200 pounds per person in America. And that should be alarming as I get into some of the information I'm about to get into. The other thing that people don't realize is how important fiber is. It's estimated that something like 95% of Americans are deficient in fiber. And fiber is critical. And we'll touch on that. But if you're not getting fruits and vegetables, legumes, and whole grains, then you're not getting that fiber. So why don't we start with talking about the leading causes of death and the authorities that are responsible for educating us about these causes of death and what we can do about them. So let's start with heart disease. Heart disease is the number one cause of death in America, has been for a long time. 20% of people die of heart disease. It's fascinating because there's so many trials that have looked at the relationship between diet and the buildup of fats and cholesterol and other substances in and around your artery walls, right? So this ain't good. So let me look at a couple notes here in some of these studies. So in one particular study, it was called a lifestyle heart trial. Patients with cardiac disease were switched from their standard diets that included meat to either a plant-based diet or the American Heart Association diet. So this goes back to the study I alluded to earlier. So that is their gold standard. The study found that 34% more patients on a plant-based diet had a reduction in that thickening of fat and all that kind of stuff around the artery wall than those on the diet recommended by the Heart Association. So again, the plant-based diet does better than their gold standard. There are other studies that looked again at people who are vegan or vegetarian compared to omnivores. In a recent meta-analysis, for instance, concluded that those who do not consume meat had significantly lower rates of heart disease and all-cause mortality. Again, that all-cause mortality. These studies consistently show that your cardiovascular risk goes down the more you eat a whole foods, plant-based diet. Not just heart disease, it's stroke. Stroke is number 5 on a list of leading causes of death in America. There was a recent meta-analysis that showed a 21% reduction in risk of stroke in highest consumers of fruits and vegetables compared to lowest consumers of fruits and vegetables. And then when you look at the risk factors for stroke, so what are the risk factors? Advanced age can do a whole lot about that. Hypertension. So lots of research on plant-based diets reducing hypertension. Diabetes, talk about that some more. High cholesterol, smoking, physical inactivity, poor nutrition, of course, family history, chronic health disease, obesity, coronary heart disease. We just talked about that. Sleep apnea and depression. So a lot of the risk factors for stroke are mitigated by a plant-based diet. Let's shift to cancer. Cancer is the number 2 cause of death, kills over 17% of people each year. The World Health Organization has already classified processed meats as a group 1 carcinogen. So it's in the same group as cigarettes, and red meat as a group 2 carcinogen. So these are cancer-causing things as identified by the World Health Organization. In 2006, there was a study of French women that concluded that women whose diets were rich in meats had a greater likelihood of developing colorectal cancer than those who did not consume large amounts of red meat. When you look at what the American Institute for Cancer Research and the American Cancer Society says, they recommend that a diet that is predominantly plant-based, that has an emphasis on whole foods, gives you the best chance to avoid cancer. That includes a variety of fresh vegetables and fruits, whole grains, beans, nuts, seeds. Now, the American Cancer Society says it is unknown if there is even a safe level of consumption for either red meat or processed meats because again, they're carcinogens. We can't tell you that it's safe. We can't give you a guideline that says just a little bit every day or a little bit every week or something like that. What do they say you need to do? They say you need to adopt a healthy eating pattern at all ages, by the way. What is a healthy eating pattern? According to the American Cancer Society, foods that are high in nutrients and amounts that help you get and stay at a healthy body weight, a variety of vegetables, dark green, red, orange, fiber-rich legumes, which include beans and peas and others, fruits, especially whole fruits in a variety of colors, and whole grains. This is what they're suggesting. Doesn't that sound like a plant-based diet? So here's the stuff that they suggest that you avoid. Again, red and processed meats, sugar sweetened beverages, and highly processed foods and refined grain products. So you're looking for whole grain products. So again, that's heart disease, that's cancer. How about diabetes? Diabetes is the number 8 cause. So what does the American Diabetes Association say? So the American Diabetes Association recognizes a plant-based diet as a viable option for patients with type 2 diabetes. So that this is one of the areas that there have been the most research. So there are a lot of analyses and meta-analyses that show that people can reverse type 2 diabetes in as little as a few days under a plant-based diet. So there was a study in 1994 that looked at patients with type 2 diabetes, and they switched them to a diet free of animal products and started them on an exercise regimen. Within 2 weeks, participants' fasting blood glucose dropped an average of 35%. And 5 of the participants, there were, I think, 21 people in this particular study, 5 of them improved so much that they no longer required glucose lowering medication. And so when they followed up with these folks long term, 4 years later, 17 out of the 21 stayed on a vegan diet and continued with their exercise program, and they continued to have improvements. So a low-fat, high-fiber diet can get people off insulin in as little as 16 days without even losing weight, according to some studies. So again, there have been so many studies around diabetes. There's no controversy there that a plant-based diet can help reverse diabetes. What about hypertension? A study in 2020 found that those that follow either a vegetarian diet or a vegan diet reported decreases in blood pressure, although the decrease was more significant in those that followed the vegan diet. So I can go down the list. I was speaking with someone recently about an autoimmune issue that they had. And we know one of the things that aggravates autoimmune issues is inflammation. Well, a plant-based diet helps protect against inflammation. And so we know that there are no negative effects from a plant-based diet and autoimmune issues. And certainly the reduction in that inflammation will help with the symptoms. So lots of studies about that. There's so much of this that is out on the Physicians Committee for Responsible Medicine website. These are medical doctors. In fact, what I'm going to talk about now is specifically from their website. What about some other popular diets like keto and paleo? You know, these diets that some people, they live by. They've adopted these new diets and like, man, I drop weight, blood sugar goes down. Well, let's explore these. So in a letter written from the Physicians Committee for Responsible Medicine back in 2019 to the head of the Department of Veteran Affairs, they talked specifically about the keto diet. And yeah, blood sugar drops in the short term under a keto diet, but it doesn't address the underlying issue, which is fat-induced insulin resistance. So, you know, there's less blood sugar in your blood, but it doesn't fix the mechanism that's preventing that sugar that's in your blood to get down through your cells, that whole process. So here's what they cited as some negative short-term implications of keto. Impaired artery function almost immediately. They said if you eat a meal, they can tell whether or not you had fruits and vegetables, or you had something else. They can tell immediately. So elevated LDL cholesterol in the short term, constipation, some people report, nausea, fatigue, headaches, some people report. More significantly, though, long term, increased risk of dying from all causes. Again, that's that all cause mortality. Decreased blood flow to the heart and worsened heart disease, impaired artery function, increased risk of colon cancer. So all these associated with the keto diet. And then there's all these other low carb diets that have a high intake of fat, and a high fat intake increases risk of diabetes within as little as 3 days. So it's fascinating. What about paleo? A paleo diet increases levels of a metabolite associated with heart disease, according to a study published in the European Journal of Clinical Nutrition. So researchers tracked this TMAO, is the metabolite. It tracked these levels and markers of gut bacteria health for those following a paleo diet, which included meat, while excluding grains and dairy products, compared to results with a control group. So what they found is decreased consumption of carbohydrates, especially from fiber-rich grains, and increased fat, saturated fat, and cholesterol intake in the paleo group led to more gut bacteria species linked to heart disease and inflammation than those in the control group. So the authors noted that these results suggest that a paleo diet pattern may be harmful to long-term health. A new study in the International Journal of Exercise Science also suggests that the paleo diet worsens cholesterol levels. And another study put 44 healthy adults on a paleo diet that included lean meat, fish, eggs, nuts, fruits, and vegetables, as well as on a circuit training program. After 10 weeks, the LDL, the bad cholesterol, increased by 12.5, and total cholesterol increased by 10.1. Triglycerides also increased slightly. It's not working. So these are just fascinating results, right? Now, I'll caution you. Now, all plant-based diets are not created equally. You got to have a healthy plant-based diet. So what does that mean? In one particular study in the UK, involving over 100,000 people, they specifically suggested that a healthy plant-based diet, and that's one that is low in animal foods, of course, sugary drinks, snacks and desserts, refined grains, potatoes, and fruit juices, was associated with lower risk of mortality and major chronic diseases among adults. So that means it's not just about avoiding animal products, but it's about trying to eat as clean as you possibly can. What do all these things mean? When you look at all these health conditions and adverse health outcomes that can be mitigated by a plant-based diet, it is incredible that physicians are not like basically writing you a prescription for a plant-based diet, because it's more effective than medications across a whole host of issues. How can we still be confused about what is healthy when the American Heart Association, the American Diabetes Association, the American Cancer Society, the World Health Organization, the Center for Disease Control, the Physicians Committee for Responsible Medicine, you got all these sources that are presenting numerous analyses and meta-analyses that appear in peer-reviewed journals that demonstrate the efficacy of a plant-based diet in reversing or preventing these chronic health issues. So we really shouldn't be confused about what we need to do. Now, the issue becomes, how do we do that? And, going back to my mind-body detox program, I'm going to be focusing on emotional intelligence. So I want to help people with their impulse control, their stress management, with their emotional self-awareness, with their self-esteem. These issues affect our food choices. I think emotional intelligence is the bridge between knowing what to do and actually being able to do it. We shouldn't be confused on what the objective evidence says about which diet is more effective in managing, avoiding, reversing these chronic health issues? It's pretty clear that fruits, vegetables, nuts, seeds, legumes, these are the things we need. The closer we get to a diet that's consisting either exclusively of those things or mainly of those things, the more likely we avoid these chronic health issues. So, a lot of wise people say, once you know better, you do better. Now, I don't know that I necessarily believe that. I think that once you know better, you have the responsibility to do better. So, are you ready to take that responsibility? Thank you all so much for tuning in to this episode of Healthy and Black. Again, I mentioned this Mind Body Detox program. Reach out to me. Go on my website, jaredconrad.com or humanlikeme.com. Read a little bit about it. Send me a note. I'm putting the pilot program together, so there's a little window where you'll be able to get this at a greatly reduced cost. Thank you again for tuning in. Look forward to seeing you next time. Thanks for joining me for this episode of Healthy and Black. I'm your host, Dr. Jared Conrad. If you have feedback on today's episode, please email info@jaredconrad.com. I'd love to hear from you. Don't forget to visit jaredconrad.com to subscribe to my blog. Thanks for listening. Please tell your friends about the podcast. Until next time, don't let culture, cost, or convenience ruin your health.